Our estimates tell us that there's almost 1,500 vacancies for UK dentists. I mean, that's a lot of vacant roles. How do you see Brexit helping that, or perhaps even making that more difficult?
Yeah, potentially a no deal or even a deal Brexit could bring some opportunities there, because not only, currently we're looking at EEA dentists, and there's changing economic development within Europe. There is increasing wage levels outside of the UK, which are taking some dentists back, presumably. And Brexit actually could potentially bring some opportunity, because it could broaden the areas in the world where we could actually recruit. And there are a lot of English-speaking areas where currently EEA rules and regulations prevent a lot of recruitment. So it could, in the longer term, actually bring some advantages and hopefully some opportunities and some solutions to those vacancies that you refer to.
Yeah, some of the difficulties we picked up is that, for example, India, they have so many dentists that they've actually had to slow down the education of new recruits and students coming into the profession. I mean, is India and other markets the sort of area you'd expect us to go and recruit from going forward? If the EU does become a difficult source of
they are exactly the sort of markets, Paul, where that we can recruit from, where we've actually got good levels of dental education, where we've got good English language skills, and a lot of dentists keen to come and practice in the UK. So those sort of opportunities will eventuate as a result of Brexit. So yes, they could certainly help going forward.
Recruitment could present huge challenges in the short term. What do you think we should do around that as a country, around getting more dentists in and making sure that these 1,500 vacancies quickly go down and we can provide better dental care to both the young, all age groups?
I think in terms of recruitment, not only in the dental sector but broadly across the NHS, can and should be addressed, probably at a national strategic level. We've spoken about the 1,500 vacancies in terms of dentists. We should be looking at working with Department of Health and Social Care, working with our overseas missions, working with the Department of International Trade, and specifically looking at having recruitment activities overseas, particularly in the areas we looked at, maybe in India and beyond, and in Asia. So working with UK government resource to actually pull in valuable and skilled workers, not only to provide dentistry within the NHS framework, but also broader NHS care going forward. So I think it might be the time for some coordinated work between dental practices, NHS and other government departments to address this issue.
What advice would you give a student?
I would certainly say that I think going forward, dentistry remains an extremely challenging, vibrant and rewarding career, and that we don't see any long-term threats to that. And I would encourage those who are thinking of embarking upon a career in dentistry, or currently studying to embark on a career in dentistry, to look forward to the wonderful opportunities that career will bring them going forwards.